Okay, if your lower back has started feeling stiff when you get out of bed, uncomfortable after sitting for too long, or simply weaker than it used to be, there's something you need to understand before you start blaming age. Getting older does not automatically mean your lower back has to keep getting worse. In fact, one of the biggest mistakes people make is waiting until their back becomes painful enough to interfere with everyday life before they finally decide to do something about it. And by that point, simple things like bending down, getting out of a chair, walking for a long time, or even picking something up from the floor can start feeling like a chore. But here's the interesting part. Your lower back is usually not working alone. Your hips, abdominal muscles, glutes, posture, and even the way you move throughout the day all determine how much stress ends up going through your lower back. So, if you want to protect your back as you get older, the goal isn't simply to stretch your lower back harder or do hundreds of sit ups. The real goal is to build a body that doesn't force your lower back to do everyone else's job. Think about what happens when you sit for hours. Your hips stay bent, your glutes aren't doing much, your abdominal muscles aren't being challenged, and your spine stays in roughly the same position for a long period of time. Then you stand up and immediately ask your body to walk, bend, twist, climb stairs, or carry something. Your lower back suddenly has to help stabilize everything, even though several of the muscles that should be sharing that workload have barely been doing anything. This is one reason why someone can feel perfectly fine while sitting and then suddenly feel stiff or uncomfortable the moment they stand up. And this is also why simply stretching the painful area isn't always the answer. Sometimes the problem isn't that your lower back needs more stretching, sometimes it needs better support from the muscles around it. Now, before we go any further, there's an important distinction. If you have severe or rapidly worsening back pain, significant weakness or numbness, loss of bladder or bowel control, numbness around the groin area, fever, unexplained weight loss, or pain following a serious injury, don't try to fix that with a YouTube workout. That's something you should get medically evaluated. But if what you're dealing with is the common stiffness, weakness, or recurring discomfort that tends to show up as we get older, there are several things you can start working on right now. And the first one might sound almost too simple. You need to stop treating movement as something you only do during your workout. Because your lower back doesn't care whether you exercise for 10 minutes this morning if you then spend the next 8 hours barely moving. Your body responds to the total amount of movement you get throughout the day. That means one of the easiest things you can do for your back is to break up long periods of sitting. You don't need a fancy standing desk. You don't need expensive equipment. Even getting up every so often, walking around your house, standing while taking a phone call, or doing a few gentle movements can give your body a completely different stimulus than staying in one position for hours. And there's another reason this matters. Movement teaches your brain that your body is capable of moving safely. When you constantly avoid certain movements because you're afraid they'll hurt your back, your movement options can gradually become smaller and smaller. The goal isn't to be afraid of your spine. The goal is to make your spine and the muscle supporting it more capable. And that brings us to the first thing I want you to work on. Your core. Now, when most people hear the word core, they immediately picture six-pack abs. But your core is much more than your abs. It's the group of muscles around your trunk that helps stabilize your spine while your arms and legs move. And after 50, this becomes especially important because maintaining strength and stability can help you stay independent and make everyday movements easier. You don't need to perform hundreds of crunches to train it. In fact, for someone whose goal is protecting the lower back, learning how to brace your trunk while keeping your spine controlled can be far more useful. Here's a simple way to understand what I mean. Imagine someone is about to gently punch you in the stomach. What do you naturally do? You tighten your abdominal muscles. You don't suck your stomach in as hard as possible, and you don't hold your breath until your face turns red. You simply create a gentle, controlled tension around your midsection. That's the kind of stability we want to develop. And once you understand that, some of the best lower back exercises suddenly make much more sense. But there's a second piece of the puzzle that most people completely overlook. And this one can make a huge difference. Your glutes and hips. Your glutes are some of the strongest muscles in your body, and they're supposed to help you extend your hips when you stand up, walk, climb stairs, and lift things. But if they become weak or inactive, your lower back can end up compensating for movements that should be coming from your hips. So instead of asking, how do I stretch my lower back? A better question is, how do I make the muscles around my lower back stronger and more useful? That shift in thinking is where we're going next. Now, let's start turning that idea into something you can actually use. One of the first movements I want you to learn is the glute bridge, because it teaches your body to use the hips and glutes without putting a lot of load on your lower back. You simply lie on your back with your knees bent and your feet flat on the floor. Keep your feet about hip width apart, gently tighten your stomach, and then press through your feet as you lift your hips toward the ceiling. You don't need to push your hips as high as physically possible. The goal is to squeeze your glutes at the top while keeping your ribs down and your movement controlled. Pause for a second, then slowly lower yourself. What you're trying to feel is your glutes doing the work, not your lower back. Start with a comfortable number of repetitions and focus on quality rather than trying to exhaust yourself. If you feel sharp or worsening pain rather than normal muscle effort, stop. And here's why I like this movement so much for people over 50. Every time you stand up from a chair, climb stairs, walk uphill, or pick something up from the ground, your hips and legs need to contribute. The bridge gives you a simple way to practice that pattern. Over time, you want your body to become better at producing movement from the hips instead of constantly relying on the lower back. But there's another exercise that takes this idea one step further, and it teaches something even more important: how to keep your spine stable while your limbs are moving. That exercise is the bird dog. Start on your hands and knees, with your hands underneath your shoulders and your knees underneath your hips. Before you move, gently tighten your stomach as if you're preparing for that light punch we talked about earlier. Then slowly extend one arm and the opposite leg. You don't need to lift them incredibly high. In fact, trying to get your leg as high as possible can actually make the movement harder to control. Instead, think about creating one long line from your fingertips through your body to your heel. Hold for a moment, return slowly, and then switch sides. The challenge isn't how high you can lift your arm and leg. The challenge is whether you can do it without your lower back twisting, collapsing, or arching excessively. This is where many people make a mistake. They turn a stability exercise into a flexibility competition. Their leg goes way up, their lower back arches, and they think they're doing a better repetition. They're not. A smaller movement performed with excellent control is often much more useful than a huge movement performed with poor control. And this principle is going to come up again and again in this video. Especially as you get older, you don't necessarily need more intensity, you need better control. Now let's talk about one of the biggest enemies of a healthy back: the fear of movement. If your back has hurt before, it's completely understandable to become cautious. You might start avoiding bending, twisting, lifting, or even walking because you're worried about triggering another episode. But if you gradually eliminate movements from your life, your body can become less accustomed to those movements. That doesn't mean you should force yourself through pain. It means you should gradually rebuild confidence and capacity. Start with movements you can perform comfortably, control the range, and slowly increase what your body can handle. And one of the best ways to practice that is something you already do every day: sitting down and standing up. The simple chair squat is incredibly useful because it trains your legs, hips, and core together while directly improving a movement you need for everyday independence. Stand in front of a sturdy chair with your feet roughly shoulder width apart. Push your hips back as if you're reaching for the chair behind you. Bend your knees, lightly touch the chair, and then stand back up. Try not to collapse onto the seat. Control the descent and then drive through your feet to stand. If this is difficult, use your hands for assistance or choose a higher chair. If it's easy, you can gradually increase the number of repetitions or eventually make the movement more challenging. Think about what that exercise represents. You're not just training your legs, you're practicing one of the most important movements of daily life. Every time you get out of bed, stand from the toilet, rise from a dining chair, or get out of a car, your body needs to coordinate your hips, knees, trunk, and legs. The stronger and more coordinated that system becomes, the less likely you are to feel like every little movement has to be carefully calculated. But there's still one major piece missing. We've talked about strengthening your core, activating your glutes, and improving your ability to stand and move. What about the stiffness that makes your back feel like it needs to warm up every morning? This is where gentle mobility comes in. And there's an important distinction here. Mobility is not the same thing as aggressively stretching until you feel a huge pull. Your goal is to give your joints and muscles regular opportunities to move through comfortable ranges. You can start with something as simple as a gentle pelvic tilt while lying on your back. Bend your knees, keep your feet on the floor, and slowly tilt your pelvis so your lower back moves slightly toward the floor. Then relax and return to your starting position. The movement should be small and controlled. You're simply reminding your body that this area can move without needing to tense everything around it. And if you're thinking, but I've had back stiffness for years, so how can a few simple exercises possibly make a difference? That's a fair question. The answer is that you're not trying to transform your back overnight. You're changing the signals your body receives repeatedly. One workout doesn't rebuild strength. One stretch doesn't eliminate years of stiffness, but consistent, manageable movement can gradually improve strength, coordination, confidence, and physical capacity. And this is where I want you to be careful, because there's a popular mistake that can completely undermine your progress. People discover a few back exercises, get excited, and decide they're going to do them for an hour every day. Then their muscles get extremely sore, their back feels irritated, and they quit. That's not the goal. Your lower back doesn't need punishment. It needs consistency. So instead of thinking about this as a massive workout, think about it as a daily investment. A few controlled exercises, regular walking, less uninterrupted sitting, and gradually improving the strength of your hips and core. Those things might sound almost boring compared with some miracle back fixing exercise you see online. But boring and consistent beats exciting and unsustainable every single time. And there's one more habit that can make all of this much more effective. Because even if you strengthen your back for 10 minutes a day, you can still spend the other 15 hours moving in ways that constantly irritate it. That habit has nothing to do with exercise equipment, and it might be the easiest change you can make starting today. That habit is learning how to lift and move through your hips instead of constantly bending from your lower back. And this becomes especially important as you get older, because you're going to keep picking things up for the rest of your life. A grocery bag, a laundry basket, something that fell on the floor, a suitcase, a box in the garage. These are normal parts of everyday life. The problem isn't that bending is automatically bad for your back. Your spine is designed to move. The problem is repeatedly asking your lower back to handle more load than it's prepared for, especially when you're tired, moving quickly, or lifting something awkwardly. So instead of thinking, never bend your back, think, learn to distribute the work. Here's a simple way to practice that. Stand in front of a sturdy object, like a chair or a table, and imagine you're trying to close a car door behind you with your hips. Push your hips backward while keeping your chest relatively tall. Allow your knees to bend naturally, and then drive your hips forward to return to standing. This is essentially a hip hinge. You're teaching your body that when something is on the floor, your hips and legs can contribute instead of your lower back doing everything. And once you become comfortable with this pattern using no weight, you can gradually apply it to real-life objects. But there's another surprisingly important factor here, and it's walking. Walking may not look like a back exercise, but it's one of the simplest ways to keep your entire body moving regularly. Your hips move, your spine moves subtly, your legs work, your balance gets challenged, and your cardiovascular system gets involved. You don't need to walk for 2 hours to get the benefit. Even short walks spread throughout the day can be useful, especially if your alternative is sitting continuously. And if walking for 30 minutes at once feels uncomfortable, don't make that your starting point. 5 or 10 minutes at a time is perfectly reasonable. The goal is to build capacity, not prove how tough you are. Now, let's talk about mornings, because this is where many people with stiff backs make another mistake. They wake up, feel tight, and immediately start aggressively twisting or bending to loosen everything up. Instead, give your body a little time to transition from being still to being active. Before jumping out of bed, you can gently move your ankles, bend and straighten your knees, take a few comfortable breaths, and make a few small pelvic movements. Then roll onto your side and use your arms to help yourself sit up rather than forcing your torso straight up from a lying position. None of this is magic, but it gives your body a gradual transition instead of going from completely still to full movement in a few seconds. And if your back tends to hurt after sitting, try something incredibly simple. Change your position more often. There's no single perfect sitting posture that you need to maintain for 8 hours. Even an excellent posture becomes uncomfortable if you never move. Your body likes variety. Sit back, stand up, walk around, change your position, and return to your chair. If you're working at a desk, consider setting a reminder to move periodically. If you're watching television, stand up during a commercial or between episodes. If you're talking on the phone, walk around the room instead of automatically sitting down. These little decisions seem insignificant, but they add up over weeks and months. Now, here's something I really want you to remember. Your lower back is not fragile glass. It's a strong, adaptable part of your body. And treating it like something that can break from every little movement can actually make you more fearful and less active. At the same time, pretending pain doesn't matter and forcing yourself through severe symptoms is not toughness. The sweet spot is somewhere in the middle. Respect your symptoms, but don't automatically become afraid of movement. This is also why I don't want you chasing the idea of a single best lower back exercise. There isn't one magical movement that fixes everybody. One person may need more hip strength. Another may need better core endurance. Someone else may need to gradually increase walking tolerance. Another person may have a medical condition that requires professional assessment rather than a generic exercise routine. The best program is the one that matches your current ability and can be progressed gradually. So if you're starting from almost zero, your first week could be incredibly simple. Spend a few minutes walking, practice a handful of controlled chair squats, perform some gentle glute bridges if they're comfortable, and practice the bird dog with small controlled movements. You can then gradually increase the repetitions or walking time as your body adapts. You don't need to destroy your muscles. You need to give them a reason to become stronger. And there's another reason I want you to focus on strength rather than just stretching. Flexibility without strength and control doesn't necessarily give you the confidence you want in everyday life. Imagine having enough flexibility to touch your toes, but struggling to pick up a laundry basket safely. What you really want is usable mobility, the ability to move through a comfortable range while controlling your body. That's what makes movement feel easier in the real world. Now, let's go back to that phrase from the beginning, before it's too late. I don't want you to interpret that as meaning your back has an expiration date. It doesn't. People can improve strength, mobility, balance, and physical function well into their 50s, 60s, 70s, and beyond. But there is a real cost to waiting until your physical capacity has declined dramatically before you start rebuilding it. The earlier you start, the more options you generally have. It's much easier to maintain strength than to rebuild strength after years of inactivity. Now, here's something I really want you to remember. Your lower back is not fragile glass. It's a strong, adaptable part of your body, and treating it like something that can break from every little movement can actually make you more fearful and less active. At the same time, pretending pain doesn't matter and forcing yourself through severe symptoms is not toughness. The sweet spot is somewhere in the middle. Respect your symptoms, but don't automatically become afraid of movement. This is also why I don't want you chasing the idea of a single best lower back exercise. There isn't one magical movement that fixes everybody. One person may need more hip strength. Another may need better core endurance. Someone else may need to gradually increase walking tolerance. Another person may have a medical condition that requires professional assessment rather than a generic exercise routine. The best program is the one that matches your current ability and can be progressed gradually. So if you're starting from almost zero, your first week could be incredibly simple. Spend a few minutes walking. Practice a handful of controlled chair squats. Perform some gentle glute bridges if they're comfortable, and practice the bird dog with small controlled movements. You can then gradually increase the repetitions or walking time as your body adapts. You don't need to destroy your muscles, you need to give them a reason to become stronger. And there's another reason I want you to focus on strength rather than just stretching. Flexibility without strength and control doesn't necessarily give you the confidence you want in everyday life. Imagine having enough flexibility to touch your toes, but struggling to pick up a laundry basket safely. What you really want is usable mobility, the ability to move through a comfortable range while controlling your body. That's what makes movement feel easier in the real world. Now, let's go back to that phrase from the beginning, before it's too late. I don't want you to interpret that as meaning your back has an expiration date. It doesn't. People can improve strength, mobility, balance, and physical function well into their 50s, 60s, 70s, and beyond. But there is a real cost to waiting until your physical capacity has declined dramatically before you start rebuilding it. The earlier you start, the more options you generally have. It's much easier to maintain strength than to rebuild strength after years of inactivity. So, if you remember only a few things from this video, remember these. Your lower back does not need to be treated like a fragile part of your body, but it also shouldn't be ignored until everyday movement becomes difficult. Start by moving more throughout the day, especially if you spend a lot of time sitting. Build the muscles that support your spine, particularly your core, glutes, hips, and legs. Practice movements like glute bridges, bird dogs, and controlled chair squats, and learn to use your hips when you bend and lift. Keep your walking consistent, work on comfortable mobility, and most importantly, progress gradually. You don't need to do everything perfectly. You just need to give your body a consistent reason to stay strong. And if you want to start today, keep it ridiculously simple. Take a comfortable 5 to 10 minute walk, then do a few controlled chair squats, a few glute bridges, and a few slow bird dogs on each side. Finish with some gentle movement and then go about your day. Tomorrow, do it again. As it becomes easier, slowly increase the amount of walking or the number of repetitions. That's it. No complicated equipment, no extreme workout, and no need to destroy yourself for an hour. The goal is to make taking care of your back something you can actually continue doing. And remember, if you have severe or worsening pain, significant weakness or numbness, bowel or bladder changes, numbness around the groin, or symptoms after a serious injury, don't try to push through it with an online routine. Get properly evaluated. But if you're simply noticing that your back is getting stiffer, weaker, and less capable than it used to be, don't wait for the problem to become your new normal. Start rebuilding your strength and movement while you still have plenty of room to improve. Because getting older is inevitable. Losing your ability to move freely doesn't have to be. If this video helped you understand your lower back a little better, hit the like button, subscribe to Prime Fit Mode, and share this with someone over 50 who keeps saying, "My back just isn't what it used to be." And if you want more simple, science-based ways to stay strong, mobile, and independent as you get older, stick around, because that's exactly what we're here to help you do.